Hey everybody, it's Ethan. I'm making a really long overdue video about my phalloplasty. It's been a year and about 3.5 months since I had stage 1 phalloplasty. That's the only stage I've had still. I've had some struggles this year in terms of insurance, and it just hasn't worked out for me to go get the second stage yet. I'm not really sure when I'll be able to do that. And at first, after surgery last year, I really didn't want to have stage 2 of the implants. But I think as the healing happened this year and I felt better and I kind of came out of that rough post-op depression I was experiencing, I do want to at least go forward with the erectile implant. I'm not totally sold on the testicular implants yet. I don't know. I'm back and forth on that one, so we'll see what happens there. Yeah, so to backtrack that a little bit, last time I made a video, I know I wasn't in the best mental states, and it took me a few months after that to really kind of come out of that post-op depression still. Actually, probably more than a couple. I think the worst of my post-op depression hit in like January of this year, February of this year, I guess. And it took until probably mid-March, beginning of April, before I was feeling a lot better. I went back on antidepressants, and that has helped. I didn't know if I was going to be able to handle this because, my arm healing and everything, and just the extensive surgery I'd had, but I started back in February with a mountaineering class, and so that was when I was, September, October, November, December, January. So I was about 5.5, 6 months post-op when I started that course, and it was pretty tough. I was trying the month before to get back into shape a little bit, so I was doing some running and hiking, and it worked out. I was definitely not in great shape when I started, but my program did conditioning, and it was actually pretty quick that I was able to get back into that. The other thing I was worried about with that was just my ability to use my left arm, because I had the forearm phalloplasty. This is kind of what it looks like right now. There's good and bad days with it. I still have some swelling at times. It's way more normal looking now than it has been. But it took a while, and when I was doing the mountaineering class, there was definitely a lot of swelling that would happen after strenuous activities, but I'm happy to say that it didn't inhibit my ability to do any of it. There were a few times where I noticed my left hand getting tired a little faster, but that was about it. I have pretty good range of motion back, and that was really just working out with the conditioning that I was doing for the mountaineering class. I didn't actually do any more hand therapy than what I did when I left Texas with Dr. Crane and his hand therapist that he worked with. I didn't do any more after that. I would do some stuff on my own, but nothing that I kept up on very well. Really, it was just time and incorporating my hand back into my daily activities. I went back to my old job of being a veterinary assistant, so I'm handling animals all the time. And I went back about 5 months post-op, and it's a pretty physical job. I'm having to move and carry things and restrain animals for 10-hour shifts, so it's a long day, and I was able to handle it, and it was okay. But yeah, I think just really incorporating my hand back into normal day-to-day activities is really what did it for me. I don't know. I don't know what else to tell people about that. I think it's really individually how well you heal and how much you use your arm. And I don't know. I think just keep working on it, I guess, if you are struggling with it. I know a lot of people have had good success with hand therapy, and I thought about it, but I didn't feel like I needed it, so I didn't. And I didn't really have a good insurance situation after the new year to do that. So, you know, some of my decisions were made for me a little bit. Anyway, yeah, so a year and some change post-op now. Trying to think of what anybody would really want to know. Okay, the big one, I guess. I finally have a partner again, and so her and I have had to navigate sex, and it's different. It's different. It's been okay. She, to give you a little background, has not had a trans partner before. She's dated heterosexual men, cis men. So I was her first trans guy experience. So there was a lot of first involved with this. I will say sex is good. I can still have an orgasm, which is great. I wish I'd come away with a little better sensation. I'm a little disappointed in the lack of sensation at this point. It's not by any means terrible, but I expected it to be better, and it's just not, and it might not get better. So it's really kind of an experiment to try and figure out what does and doesn't feel good sometimes. I don't know. We're thinking about making a video about this later on, so I might just save more talk about how sex is. I will say there is a little bit of a process, since I don't have the erectile device yet, to getting ready, but it hasn't been that bad. I use a combination of something called Coban tape. It's like a self-adhesive. It's not really a tape. It's more like a wrap, but it adheres to itself, and a lot of guys use it. I think it also goes by the name Coflex. There's a few different names for it, but Coban tape is what I use, along with a little bit of it's like a kind of a, I don't know what to call it. It just helps give some more rigidity to the phalloplasty, so I can actually penetrate, which I can, and it works fine. I did try. What did I try? I tried the. The elator. I ordered that. It did not work for me. My glands kind of healed a little flatter than I would have liked, and so there's nothing really to use that with. For those of you that know what I'm talking about, you can Google it. Just look for elator. I was hopeful that that would work. It doesn't. So unfortunately. Kind of a waste of money, but you know, we are in the trans community are pretty creative, so I don't know, we figured it out, and the method we have works. We did go to a few sex shops and try to figure out what they might have, and tried to explain my situation to some of the workers, and they were great and really tried to help, but I don't quite think they were understanding what I had done. Even at we went to a queer sex shop, and they still didn't really. I think one of the workers knew about phalloplasty, but still didn't really know what exactly to do to help. So it was a little disappointing, actually. But you know, we figured it out. So yeah, that's all. That's good. So yeah. Anyway, I'll move on from that topic. Sorry, I'm not as good about talking about that. But if you want to have like personal questions, you can ask. I may or may not answer them, but feel free down in the comments. Yeah. Anyway, overall, I guess what I wanted to say was I'm doing much better. Things are good. Like I said, I'm still considering going through this with the second stage, so the implants, but I don't know at this point when that will be. And yeah, I don't know. I definitely am glad I made the decision I made. I don't have any regrets at this point. You know, do I wish some things could be better? Yeah, but I think that's always going to be the case. But I think, I think just being happy with what I have and all the things that it has provided for me. So, for example, this year when I did my mountaineering class, I started off and nobody knew I was trans, except my friend that went with me to do this. And I ended up coming out to some people while I was in the course. But it was nice to be able to like go on these conditioning trips and go on these hikes and go climb mountains with people and just be able to pee like one of the other dudes. And I really bonded with a group of guys, and it was nice. A few of them eventually ended up knowing, but it was nice just to be able to like hang out and like one of the big things is like learning to pee on the side of a mountain. Not that you have to learn how to do that, but sometimes when if you're a little pee shy, that can be hard. So some of us had to get used to peeing, not necessarily in front of other people, but while other people are kind of like standing behind you or something. There's not a whole lot of options when you're on a very exposed section of mountain. So anyway, I don't know. I couldn't imagine having done that pre-phalloplasty. So I'm really thankful that I had the chance to have that surgery, and I know I'm very fortunate to have had it. So yeah, it's little things, like I don't have to worry about certain things now. But on the flip side, there are still things that are hard. I do have to explain sometimes to doctors what's going on. I've had a few that I didn't have a great experience with since phalloplasty that weren't necessarily bad, but just not great experiences. So anyway, there's a lot to be learned in the medical community. So that's one of the areas in which I still struggle a little bit, is when I have to go into a medical setting and re-explain things, especially if I'm having an issue, which generally at this point has been, I've had a couple UTIs, urinary tract infections since having surgery. That's happened about 3 or 4 times over the course of a year, so not bad, but sometimes it raises a few questions. I had one doctor say to me, most of us guys don't get UTIs, so kind of wondering what I was doing. And I explained to him, the only thing I told him, because he wasn't my regular doctor, was that I had a urethral reconstruction, and so he kind of took it at that and said, you may want to go back to your surgeon and get things checked out. So anyway, yeah, there's just sometimes where I don't enjoy being in medical settings still. So that's that. But overall, like I said, I'm really glad I had the surgery, and it's amazing what a year and some change will do in terms of perspective out. That was such a tough recovery afterwards, mentally, and I didn't even really have any major issues. I had a couple infections and a fistula, which did end up healing on its own, and yeah, otherwise things have been pretty good. So anyway, any questions, let me know, and I will try to answer them. Take care, everybody.